Diabetes mellitus, it is a chronic disease in which the sugar level or glucose level in the body is high because the body cannot produce enough insulin or make proper use of insulin. You know that insulin is a hormone which is being produced by the pancreas. Then this insulin help in the regulation of the glucose level in the body, and also insulin help in the movement of glucose level into the blood cells. So insulin plays a vital role in the body. So when the insulin level is not being regulated, or when the insulin is not being controlled, the person will have what diabetes mellitus. Causes of diabetes mellitus. Diabetes mellitus can be caused by hormonal disorders. It can be caused by genetic, like when it's genetic, like when it runs in your family, it's hereditary. Then it can also be caused by pancreatic disorder. Pancreatic disorder in the sense that your body cannot produce enough insulin, making you to develop what type 1 diabetes, or your body can produce insulin but it's not making proper use of the insulin, it will now make you to develop type 2 diabetes. Now we'll be talking about types of diabetes. We have about three types of diabetes. We have type 1 diabetes, we have type 2 diabetes, and gestational. In type 1 diabetes mellitus, the patient cannot produce enough insulin needed by the body, so they are insulin dependent, and it mostly occurs in children and in young adults. So insulin dependent people with type 1 diabetes mellitus, it can be managed using insulin injection. While in type 2 diabetes mellitus, they produce they produce insulin, but the body cannot properly make use of the insulin, so they are insulin resistant, and it occurs mostly in adults. And people with type 2 diabetes mellitus can be managed using oral medications. Then next one is gestational diabetes. In gestational diabetes, this is a type of diabetes that occurs during pregnancy and it resolves after delivery. But if not properly managed, the patient will come down with type 2 diabetes mellitus. Now, let's talk about the signs and symptoms of diabetes mellitus. It includes they used to have experience increased thirst, frequent urination, increased hunger, weight loss, excessive thirst, blurred vision, and they also experience delayed or slow wound healing. Complications of diabetes mellitus include diabetic ketoacidosis, heart disease, kidney failure, erectile dysfunction, foot ulcer. It can also lead to amputation, stroke, infection, hypoglycemia, and also hyperglycemia.